Hi guys, welcome back to our YouTube channel. This is Sahl Health, and today we are pleased to have an amazing guest, Elizabeth Mutunga, who is the founder of the Alzheimer's and Dementia Organization of Kenya. Welcome, Elizabeth.
Thank you for having me.
Yes, so you can tell us more about yourself and what you do and more about the Alzheimer's and Dementia Organization of Kenya.
All right. So I'm the CEO and founder of the organization, and the reason why the organization started was because my dad had dementia for, we could say 17 years, but we knew what it was on the 15th year, and we had been struggling to try and understand what is happening with him. We had seen changes in his personality, changes in his behavior. He's selling the car in parts. The tires are low, the rest of the body of the vehicle are low, which was quite strange and weird. And so we started trying to figure out what is it. And so in the 15th year, that's when the doctor told us that he has dementia, Alzheimer's type. So this made me want to help other caregivers not to take such a long time to get diagnosis or even to get help for their loved one and for themselves. Yes.
All right, I'm sure a lot of people are wondering, how do you identify Alzheimer's? How do you identify dementia? How does it present maybe in the early stages of the onset of the disease? Yeah.
So maybe we would start by trying to understand what dementia is. So dementia is an umbrella term that shows the changes in personality, in the behavior of an individual, and there are many types of dementia. Alzheimer's is one type. We have Lewy body, we have dementia due to HIV, dementia due to alcohol, dementia, frontotemporal dementia. So there are many types of dementia, even Parkinsonism is a type of dementia. So some of the symptoms that you'll notice, like I said, is memory loss, and then also repeating themselves, the repetition. We also have them wandering away and not being able to get back home, something that you would not even think about. I mean, you know your way home, and then all of a sudden you cannot remember how to get home, and then lack of motivation in doing things that they used to do before for themselves, and so that also becomes an issue. So a lot of times you will notice that there are all these issues with their loved ones, and those are the symptoms that you start picking out as the disease begins. Yeah.
Oh, okay, that's interesting. I'd like to also know, as an organization, what do you do? Because mostly people will ask, what does ADOK do? How does the organization help people with Alzheimer's and dementia cope with the disease? And you've earlier mentioned that it can only be managed, it can't be cured. So as an organization, what do you do?
So what we do is training caregivers so that they can understand how to better manage the condition and how to care for their loved one with dignity. And I say dignity because a lot of times they may behave in a way that can really irritate you as a caregiver, and without knowing it, you could actually end up losing your mind. So it's very important for them to understand how to care for their loved one, how to communicate with their loved one, how to even just would they go and approach when things are going south. For example, when they've noticed now they're packing their bags in the middle of the night and they're saying they're going home, and what do you do? So either if they have to see a psychiatrist, also to have medication given, or if they need to see a neurologist to get a proper diagnosis so that they can know which type of dementia it is. So we are in the space of just trying to help caregivers understand what the condition is and the steps forward. And once they get their diagnosis, then we work with them with giving them information according to the type of dementia that their loved one has.
That's nice. So does this mean that you have psychiatrists on board, neurologists on board that help with the diagnosis and treatment?
Yes, we do. We do have psychiatrists on board, and also we have palliative care doctors. So that also can help us also when they get to that point where they are maybe in the severe stage and the last stage of their lives with the condition, so that they also help the family on how to better take care of their loved ones. Yes.
Interesting. That's really nice work you're doing. Congratulations for that.
Thank you.
Yeah, also I'd like to know, when did you start the organization?
So we started in 2007 initially, and what happened is I was looking, at that time I was taking my training in psychology, and I needed to write a paper about a condition that people did not know about, and so I decided to write about dementia, And while I was writing about it, I decided, okay, but how come all the other terminal illnesses, there are support groups, but there was no support group for dementia.
Yeah.
And so I decided, I looked for some people, and we started a support group, and we started meeting. But when my dad passed on in 2009, I did not want anything to do with this, and I shelved the idea and everything and moved on with my life. In 2013, I got like 3 calls from, actually 5, from different people who had loved ones with dementia, and they wanted us to start meeting and give them support. So I told them, okay, let's come. But then I was still very upset because I told God I did not want to do this anymore.
Yeah.
And so I went and met them, and then from then on the support group grew from 5 to 30, and the numbers keep increasing as we go along. And actually we stopped the physical meeting in 2020 when now COVID came, but we still have online support. So that is how the organization started. So in 2016 we made it an NGO.
Oh.
Yes.
Okay. So I'd like to know, as an organization, what has been the highlight, maybe? Have you had any member of the organization have maybe a loved one or themselves have any type of dementia and probably have been able to manage it in a nice way?
Well, we have many success stories. And when I say success stories, is that when the caregiver finally understands what their loved one is dealing with, then they're able to cope better. And so that is when even we have a Telegram group where we have, it's an online support group where people can write if they're having issues with their loved one, maybe going to the bathroom or even showering or even whatever they're going through. So all that has been very important for the caregiver to be able to deal with them. And then also the other highlight is that the Ministry of Health has recognized that actually this is an issue, and they've come on board to help us with creating awareness about it. And as we're launching the World Alzheimer's Report on 21st of September, the Director of Mental Health was at the forefront, and he's stating that this is a condition that really needs to, we need to pay attention to it because the numbers are growing, but also we need to start having data on the same.
Yeah, definitely. Also, are there any challenges that you are facing as an organization that's maybe hindering how you present information out there, or maybe that's hindering the management of the same?
And so some of the challenges that we're facing are, because a lot of us are volunteers and we do a lot of work from our own pockets. So we'd love to go out there, to all the counties and create awareness, but sometimes you're constrained financially. But we are glad that people are reaching out to us from these different counties. Also, we have set up Mombasa, we've set up Kakamega, we've set up Nyeri is ongoing. We are having people who are even thinking of one in Kajiado. So people come to us and say, you know what, I'm from this community, why don't I do something? So that has been a blessing for us. So yes, there are challenges, but at least we are still spreading our tentacles to try and create more awareness.
All right, so I heard you mention an initiative by the government to come in terms of managing Alzheimer's and dementia. So do you think that will be a success?
I believe so, because we have been working on also a project called Stride, which is strengthening dementia responses in developing countries. And a lot of the government has also been very supportive, because one of the things that WHO has demanded of each country is that we should have a national plan, and the Director of Mental Health has been very passionate about ensuring that this is done. And so with the Ministry of Health, they have been working on ensuring, and also the geriatric departments, they've been working very hard to ensure that we have this national plan. So the plans are underway, and they are at the forefront running with this, so that is good for us. Most of the similarities is that most countries do not, especially African countries, dementia is still not considered a disease. Most people think it's normal aging. So when you tell somebody you have dementia, it's part of normal aging. They should be behaving that way. So it's never given the priority. So other conditions, cancer and all these other conditions, diabetes will even be given priority. Yet diabetes can actually contribute to dementia.
Yeah.
So, but dementia has never been given the priority it actually requires.
So what are the triggers of Alzheimer's and dementia?
So the risk factors are diabetes, blood pressure, cholesterol, and then also your body weight. It can also contribute to dementia. And then also if your diet, whatever you eat can also contribute. So they say you have the Mediterranean diet. And so those are some of the things that we ask people to watch their diet. Another thing is that, for example, now a lot of us are using motorcycles on the road, and some of us maybe even do not wear our helmets. So if you, God forbid, if you actually hit the ground, because we've had cases of people who have either been attacked by thugs, for example, and they were either injured on the head, and then later it presents as dementia. So some of these things we just need to be careful and take care of ourselves to ensure that we reduce on the risk factors. So how you can manage it, by the way, and things that you can do is learn maybe a new language. As you're doing your physical exercise, make sure you're also doing your brain exercises. So you're doing your Sudoku, you're doing your crosswords, you're keeping your mind healthy. Social interactions, people who have been known to be loners sometimes get dementia. Not everybody, but some of them get dementia. And then also another thing is that also if you're drinking and smoking, do it in moderation or stop completely. And also watch your weight, what goes in the stress levels. Try and work on your stress, because a lot of people will tell you our loved ones, and also losses. How do you deal with your losses? For example, loss of money, loss of maybe a spouse or a child could have, some of the people it has led to them having their loved ones having dementia.
All right, I hope you all heard it, that we need to check what we eat. We need to take wellness checkups just to know our diabetes levels, our cholesterol levels, just to know, and also to ensure that we are not at risk of contracting Alzheimer's and dementia. And also for our loved ones, let them have wellness checkups routinely. Let us exercise. Let us have fruitful social interactions just to ensure. Elizabeth, we'd like to know, for the management and treatment and getting the drugs, does the insurance cover for those expenses?
No, they don't. But I know KCB had done a presentation to the caregivers saying that they will start covering, catering for people living with dementia. But before that, we did not have any insurance that was taking them on. Yeah.
So has it already been implemented, or it's still in progress?
No, because you see, the thing is, every caregiver makes their own decision. As an organization, we give the information, and then the caregivers decide if they want to go that direction.
Yeah.
So usually it's their own call, but they decide which way to go as individuals. Yes, and as families.
Oh, okay.
Yes.
So do you have any statistics maybe of the people who have benefited from your organization through the management of Alzheimer's and dementia?
Maybe I can say that now from what people now, the ones who've liked like our pages, I think that is how we can measure. And then also on Telegram group, we have almost 300 people. On LinkedIn and Facebook, I think we have the followers, we have a large following, which is over 2,000. So I think that is how we can measure and know if we're actually making an impact. And then being called by you, that means you also will see us.
Yeah.
So I think it's very hard to really say, but people call every time we're on either the newspaper or on telly or radio, or even now maybe even on your channel. We get people calling, and when you talk about the symptoms, then they will tell you, I think my loved one has these symptoms.
Yeah.
So that is how we could measure.
Oh, okay, that's nice. So when you talk about, do you have donors who have donated funds to your organization, or do you have maybe a platform where they can just donate, maybe from your website?
On the website, yes, there is a place for donating, but also we've had opportunities to work with the Alzheimer's Society of Ireland, and we've come up with a training program called DPIC, which is giving knowledge to caregivers, the training for the caregivers that I talked about earlier. So we have received some money to do the training for the caregivers. On Stride also, we've been able to get I would say a good donation to be able to create the awareness that we require as an organization, but we work with a research organization also to create awareness, the Africa Mental Health Foundation. So those are the two organizations that actually we've been blessed to have the money to try and do most of the work, and especially to try what we realized, as much as we really needed the numbers to know how many people are living with the condition, we are having an issue of stigma. So we decided to come up with a stigma intervention, so a stigma toolkit, where we can be able to now have people start talking openly, then we will have the numbers. But as long as there's stigma, nobody will come out and say, my loved one has dementia.
Most of us, and even ourselves, we just know Alzheimer's and dementia because we're in the health space. But people who are not in the health space probably don't know about it. And there's that aspect where until something has affected you, that's when you come to know more about it. So what efforts are you putting in to ensure that people know more about Alzheimer's and dementia?
So what we are doing is we use our platforms to educate the public and the caregivers about issues of dementia. We are using also media. We're using what we are also doing is ensuring that we have, like I said earlier, we have support groups in other counties. So we in Kakamega, Mombasa, Nakuru, Nyeri, and so we're trying to go into all the counties to try and create awareness on dementia. So that's another way that we know that once we have people there, then we are able to create more awareness. Another thing that we are doing is we're working with the Ministry of Health, and we have been working also on the project that I was talking about, Stride. So we'll be training community health workers who are taking care of the people in the grassroots. So they will be going out to check how are their families that have been affected by dementia, and with that also go with information. Then we have pamphlets that they can give out that are in both Kiswahili and English, so that we can be able to get a wider reach. So that is what we are doing. Like I said initially, with funding we shall do more. With what we have, that is how we are doing it right now.
Okay, this is a call to all of us to take part in ensuring that people are more sensitized about the disease, and as well as helping our loved ones manage the disease. Maybe you can give a call to the people watching this on how maybe they can reach you out, on how they can become members of the organization, on how they can even donate to the organization.
Okay, one of the things is that you wouldn't want to see your loved one struggling to remember you, trying to remember how to do the daily things that you do without even thinking about it, even to the point of even just breathing, things that we don't even think about. So it is, I'm requesting and imploring you that if you could come in and help our family. There are families that are really struggling to get diapers, there are families that are struggling to get medical attention, there are families that are struggling to just understand what they're dealing with, and even just to go to see a doctor costs a lot of money. So if you're out there and you're able to support, we're grateful for that. Our website is www.alzkenya.org. Our social media handles and all that is in our webpage. And you can read and see what we have done, and also maybe tell us what we can do better to be able to reach more people. Thank you.
All right. So you know how you can get in touch with Alzheimer's and Dementia Organization of Kenya, and as well you can always stay tuned for we bring you a lot of information that you definitely don't want to miss out on. And so parting shot, do you think as a private organization we have a part to play in ensuring that Alzheimer's and dementia is managed properly?
I think everybody has a part to play. We all have to be, even as an individual, everybody has a part to play to make sure that we understand what it is, support somebody else, or even our neighbor, our relative. It could just be somebody you meet on the road who's asking for directions, but you can see they are looking hazed and they did not know exactly what they are talking about. So it's upon each one of us to make a difference to that individual who's living with dementia. So everybody has a role to play.
That has triggered a lot of, not really emotion, but it has triggered something in me. Sometimes, especially in the streets of Nairobi, someone will ask you for directions and you'll look at them like, are you sure you don't know directions? Or rather, because of the high crime rates in the country. But then again, this is a call for all of us to be kind to one another. Be very keen on how each and every one of you or each and every one of those around you are acting so that you can be able to manage this disease. So where do you see yourself in 5 years?
In 5 years, we are hoping that we shall have a respite center, a place where caregivers can come and leave their loved ones, and then they go and take a breather, and then come back and pick up their loved ones. But we'll have activities, art therapy, music therapy, all kinds of therapies for their loved ones. So that is our plan, God willing.
Okay, I've already pictured it in my mind to be a hub for all the services, and basically the fact that we also have to take care of our caregivers because they determine how well the disease is managed. Yeah, so with that said and done, I hope all of us stay tuned to this channel to get more information about diseases, about our wellness, about our health generally. And thank you so much for watching.